Barnesdale, and I'm on staff at the Greater Reading Chamber Alliance. And we're here for another episode of Chamber Spotlight. And I'm thrilled today to have a relatively new member, and that is Kryn McClain, and she is with Paragon Behavioral Health Services, LLC. So welcome.
Thank you.
Welcome.
Thank you.
Kryn. And I was looking at your website before we came down here at the studio, and I was just thrilled to see that it's really a women-owned business.
It is, yes.
Which is very exciting for me as the founder of Women to Women. I don't know if you've been to any of our events or functions, but this is what we love to see: the story of women getting together, the power of women, and starting a business.
Yes.
And I think that alone probably differentiates you from some of the others that do what you do in the community. So we want to make sure that our members are aware of what you do. So tell me a little bit about, first of all, why you decided that this was the direction to go in, starting your own business with your partners, and also a little bit about what you do that might differentiate you.
Sure, thank you for that question. We really wanted to create a new type of place to work in our field. We were a little bit unsatisfied with our options, so we wanted to create a more diverse setting where we didn't have as much red tape to be creative, to be innovative, to have new ideas, to develop programs. So we wanted a place where we could have a little bit more decision-making power instead of having a lot of red tape. So we came together and just decided to form an LLC and see where we could go from there.
So interesting, and I think that you're probably, absolutely right in terms of, when we look at any of sort of the medical professions and in various, disciplines, there's a lot of red tape. And so I think what you probably saw how much more could be done for the actual patient.
Correct.
If there wasn't that red tape impeding you from doing what you wanted to do.
Correct.
Now that's a big step, because you know where you want to be. You know that there still is, some amount of red tape.
Correct.
that has to be managed, if you will. So how have you felt in this past year, or a little over a year that you've been in business, that you've been able to manage that and get to? Have you gotten to really start to see where you want to go in terms of making that change and doing things a little bit differently?
Absolutely, because it's not only benefiting our patients, it's also benefiting our employees. So
Interesting.
we felt if we could really increase employee satisfaction, we could better serve our patients as well. So it's kind of a twofold plan that we had and wanted to establish to do things a little bit differently. And anytime we've kind of hit barriers, because of course our progress wasn't a straight line, we really put our heads together as a team and really worked together to figure out what we needed to do to get to the next step.
So talk a little bit about what your core services are.
Sure. So we have two programs right now. We have a private practice which serves the mental health population, so it could be really anything, a wide variety of presenting problems come through our door. Me personally, I'm trauma certified, so I see a lot of trauma patients.
Okay.
One of my partners is a sex therapist, so she sees a lot of sexual dysfunction and things of that nature, and we just have a really diverse population for our outpatient clinic.
Sure.
And then we also have an autism program where we service anywhere from 18 months on to 21 years, and we're working towards securing our adult waiver so we can continue those services straight on through adulthood, because we've seen a need for that.
Sure, sure. And it's interesting because I know that through, I think both this current and the last community health assessment of Berks County, that mental health was an issue.
It was. I believe it was the number 1 and 2 with obesity.
Yes. And so that really, I think that was kind of a aha for me to think, wow, this is an issue that our community is dealing with.
Yes.
So, I think clearly to be able to offer a new way of looking at and dealing with this really broad brushstroke of challenges. Because when you say mental health, it can be a lot of different things.
Absolutely.
So how would you say you have treated something differently that you might have seen, in your previous experience as a professional?
Sure, that's a great question. We really started with our website. So we designed it a little bit differently than I've seen it. So patients can get on and message us instead of calling us.
Okay.
So messages go straight to my email. I get an email, it comes through my watch, it pops up. I'm able to respond very quickly and get someone set up with an appointment.
Wow.
Without having to
Wow.
physically call if they're uncomfortable doing that.
Sure, and that probably is, the first step is like, how do I pick up the phone and make that call?
Sure, absolutely. We get that a lot. We've had a lot of positive feedback with that. Another thing we offer is a telemedicine option. So if people are uncomfortable coming into the office, or there may be some barriers with work or transportation, we do offer a secure portal to provide those services as well.
Oh, interesting. Okay. Okay. How are you getting the word out that you're here and that you're open for business?
Sure. One of the main portals we use is Psychology Today. It's an online format where a lot of people go to and essentially Google, but they use Psychology Today to find therapists. So you get to see a profile picture, read a quick synopsis of the therapy a therapist provides. So each of our therapists have a profile on there, and then we also do other social networking through Facebook, Instagram, things of that nature, for the autism program as well, to network with the Autism Society and the different Berks County groups to let people know, hey, here we are, we're providing this service.
So are you also reaching out, for example, and I don't know what the structure would be, in school districts, if it goes school district by district, or does it go through the BCIU, or are you connecting there to find
mainly with the BCIU for the autism program. They're aware that we're open, and we get a lot of referrals through SAM and BCIU. And
and SAM is Service Access Management. For those who are listening or seeing that, it's another agency in our community that would be a resource. And I think it's great because I would think that the need to really build awareness of the services that you provide, and and just the structure that you have is highly important.
Right, and I feel like when a new autism provider pops up, it almost spreads like wildfire. So even networking with our competitors to say, hey, if you can't staff a case, would you mind sending them the referral to us, and vice versa? Yeah,
great idea. Great idea. And I think that is also something, and perhaps one of the things by sharing some of this is to break down those barriers of how people perceive either autism and or mental health.
Yes.
That is not something that we should be not taking care of.
Correct.
Because of a stigma that might be attached.
Right.
That this is just as much of a healthcare issue in our community as obesity is.
Correct.
And that's and I think people are building more and more of an awareness, or finding more of an awareness about the need and about that there are resources. So I'm hoping that this will do a little bit or a lot to make Paragon more in people's mind, a great community resource, and I wish you great luck, because I think it's very exciting that, as I read in your website, that you and your partners just decided this is what we're going to do, and we are going to jump in and make a difference. And women are making a difference all over the place. So thank you so much.
Thank you very much.
Appreciate it. And thank you for being with me today.
Thank you for having me.